welcome to The Vaccine. I'm Jeremy Fernandez. There have been a lot of developments on the COVID front this week. As Victorians come out of their fourth lockdown, has enough been done to avoid a fifth? We'll also take a look at the confusion about how many Australians are vaccinated and just who is eligible. And new advice for pregnant and breastfeeding women. That's coming up. But let's start tonight with experts urging people to be informed but not alarmed about that rare blood clotting condition that's linked to the AstraZeneca COVID vaccine. The medical regulator says the vaccine is likely to be a factor in a blood clot suffered by a 52-year-old woman who died this week in New South Wales. Authorities say while it's unfortunate, there's been some progress in diagnosing and treating the condition.
I will point out that it's only the second death, with now over 3.6 million doses of this vaccine being given across Australia. I will point out that this remains an extremely rare event to get these serious clots, but when they happen, as we've seen in this case, it can have tragic circumstances.
Communities across two states are on alert after a couple who didn't know they were infected left Melbourne's lockdown and travelled to Queensland's Sunshine Coast via country New South Wales. They left Melbourne on the 1st of June. They drove through regional New South Wales, stopping at several shops, cafes and petrol stations. They also visited a cinema in Dubbo and Morree's thermal pools. They then entered Queensland via Goondiwindi and stopped briefly at Toowoomba, arriving in Caloundra where they later tested positive. Let's go now to our reporter Jean Edwards in Melbourne. Jean, the events of the past week or two have spooked a lot of people. How are things feeling there now that the lockdown has eased?
Well, look, there are plenty of pleased parents and relieved retailers here in Melbourne. Kids are back in the classroom, shops have reopened, and the city's cafes have been buzzing, albeit with density caps, and some of them can't open at all. Now, you could say there was a collective sigh of relief this morning when we learnt there are no new community transmission cases of coronavirus, but Melburnians are being warned against complacency. Now, the Chief Health Officer has said that, more cases are likely to emerge in the next week or so because there are still thousands of primary close contacts who are in quarantine but may well test positive.
And so what are the testing rates like right now?
Yeah, well, we saw a huge surge in the number of people getting tested in the initial stages of the outbreak. I think the numbers peaked at around 57,000 in a 24-hour period at one point, but they've dropped off quite a bit. There were only 17,000 yesterday. So health officials really want that rate to rise, especially in places like the city's north where there have been cases of community transmission. And the Chief Health Officer said, if people are convinced they've got a cold, they should still go and get tested. And over winter, you could expect to get tested once, twice, maybe 3 times. He says people should get tested. And that's the only way that we're going to know where this virus is and get rid of it.
What sort of restrictions are still in place and how much of Victoria is subject to these tentative rules for now?
Yeah, well, restrictions have eased more in regional Victoria, but they lifted here, or the lockdown lifted here overnight, but there's still a lot of restrictions in place. So people can't have any visitors to their home. You must stay within a 25-kilometre radius of your home, so that means no one can go to regional Victoria for the Queen's birthday long weekend. And Melburnians must still wear a mask both indoors and out. Now, health authorities changed their mind about that mandatory outdoor mask rule after they discovered 4 mystery cases in one household in Reservoir in Melbourne's north. And contact tracers are still trying to find the source of that infection. And the Chief Health Officer has been questioned at length about the rationale for that mandatory rule with masks outdoors. And he said that, transmission still happens outside and that wearing masks substantially reduces that risk.
Jean Edwards reporting from Melbourne. Thank you. So let's take a closer look at the case numbers in Victoria. The 7-day average, a concept Victorians know well after last year, is now down to just over 3.5 after hitting a peak of 7. This outbreak has been relatively small, but nonetheless it has a long tail. So as Victoria charts a way out of this outbreak, how far are we from having enough people vaccinated to avoid more extended lockdowns? Well, about 140,000 doses are being administered each day at the moment, and that's double the rate of what it was a month ago. The nation's just tipped over 5.5 million jabs in total, but the federal government is still not publishing regular updates on how many of those are first doses and how many of those are second doses. The best estimates using information from state governments are that around 650,000 people have now had both doses of their vaccine. And we're still unable to tell you the vaccination rates among each age group, including the most vulnerable, older Australians. Let's bring in Dr. Abra Chugtai, who's a medical epidemiologist at the University of New South Wales, and Professor Julie Leask, who's a social scientist with specialisation in nursing and vaccination rates. Welcome to both of you. Dr. Chugtai, I begin with you. Despite all the information that's collected when a person registers to be vaccinated and then is vaccinated, the data is still so patchy. Why is that?
I think that that's the main problem is the different vaccination sources, vaccination through federal government and vaccination through state government. So generally, it's easy to publish that data because they should have this data that how many cases have already vaccinated. We know that overall around more than 5 million cases have been vaccinated. But as you rightly pointed out, we don't know that how many are fully vaccinated. Some other open source database also showed that around 600,000 cases have been vaccinated. But I think government should have this data. But the main problem is that the vaccination is being rolled out through government source as well and through a state as well. So probably at this point of time, they are unable to compile that data.
Professor Leask, how accessible is this data? How easily can it be published?
It depends on the risk group, Jeremy. So if we're looking at age groups, it is easy to be able to publish that data on what the vaccination rates are for the age groups, people who have received 1 dose and 2 doses. And the federal government does have that data, and we are calling on the government to provide that data. The reason is this, that when we all know how we're going with vaccination rates, both for 1 dose and 2 doses, then we can get that feedback as a nation. We can see how we're travelling and see where we need to improve. And that itself, that feedback, will improve our vaccination rates.
Professor Leask, we mentioned a moment ago this woman in New South Wales who died as a result of this rare blood-clotting disorder. There are a lot of people around the country who are reticent about taking the AstraZeneca vaccine because of that risk. What do you say to those people when a 52-year-old has died, who is someone who would be deemed to be in the lower risk age group?
Yeah, this is a very tragic thing. We don't want anybody to die from a vaccine, and it does look like the vaccine has been the cause here. The rate of death for even the people with this TTS syndrome, this rare clotting disorder, is very low. Most people have been in hospital and have been able to recover with appropriate treatment. It's important that people are aware of what the early signs of this syndrome are so that they can get medical help as soon as possible. But what we will say to people is that many medicines come with a risk. It is serious, but it's low. And that means that we need to think about both the risk of the vaccine and the risks of getting COVID and all the other risks around COVID. And I think most Australians are able to weigh up risk and benefit. They do it in everyday life. We do it with other medicines and treatments, surgery and so forth. And when we consider the benefits of vaccination, they are also very significant. So we're looking at not just benefit to ourselves as individuals, protection from severe disease in particular, which all the vaccines are good at doing, but also protection of each other through the reduction in the risk of transmission to others, and also that social benefit of us as a nation being able to have security, being able to return to the kinds of functioning we saw before the pandemic. And all of those things are important to people, and people weigh them up when they make vaccine decisions.
Dr. Chugtai, we've got a situation where a person's eligibility to get the vaccine depends on which state or territory they live in. Would a standardisation nationally help this rollout and get the message out there and reduce the amount of confusion?
I think so, because at national level, I think I prefer that there should be standardization because that will give a correct message, and people will be getting exact message which age group we should vaccinate. But I think I personally feel this is not probably a major issue. Ideally, it should be, but probably we have other issues as well which need to be addressed at this stage, because I think at this point of time only Western Australia probably they have 13-year age cut limit. Otherwise, all other are now currently vaccinating 14 and above. So as I mentioned, ideally it should be to avoid confusion, but probably we have some other, at this point of time, we should address the other major issues like vaccine supply, quick vaccine rollout, because we are a bit slow as well. And also, there's some issues of vaccine hesitancy as well. So I think there are probably other bigger issues probably which need to be addressed first.
Professor Lee, some advocates say incentives are a good idea. In fact, the TGA has amended the rules to allow for that to happen. You've studied a great deal about this. Are there some incentives that work better than others?
Oh, that's a great question. Look, I think the studies vary, Jeremy. So there are studies that show that vaccine incentives can have an impact. They might be food, for example. In some countries, people are getting 2 cartons of eggs or a bag of flour. In other countries, people are getting financial incentives, such as in Serbia. And then, of course, we've heard a lot about the US, where they're going into a big lottery where you stand to win a lot of money. Now, the literature on this is mixed, so they can work in certain circumstances. There's early data to show that for some people, an incentive, a financial incentive in the US can make a difference. But for certain people, it won't work, particularly people who are less trusting of the government. If they feel like they're getting a kind of overt kickback, they may be even less trusting of vaccination. So, we've got to be fairly nuanced and targeted and evidence-based in whatever strategies we choose, and no one strategy on its own is going to be effective. We need a whole range of things because there are a range of barriers to vaccination.
Julie Leask and Abra Chugtai, thank you both for joining us.
Thanks.
Thanks.
Well, the ABC's medical reporter Sophie Scott is with us now. Speaking of opening up some options for more people, Sophie, there's been some updated advice for pregnant women and breastfeeding women. What's changed?
Yeah, look, this is exciting. Up until now, it was really a matter of individual women talking to their doctors to see what the advice was for them. But this week, the College of Obstetricians and Gynaecologists got together with the government's expert committee on immunisation, and they're now saying that pregnant women can be offered the Pfizer vaccine at any stage of their pregnancy. And that's because they've recognised, looking at the data, that women who are pregnant and their babies are at increased risk of complications from COVID. And they've also looked at the data of women who've had the vaccine when they're pregnant, and they've found that it's safe and there's no serious safety concerns. So putting those two things together, the College of Obstetricians and Gynaecologists and the government's expert group have made that recommendation. So that means that, women have a choice. You don't have to have the vaccine, but what they're saying is they now recognise that women who are pregnant are at that increased risk of complications, and they know the vaccine's safe, and so women can now have the vaccine if they choose to do so.
And is it safe for the baby in both pregnancy and breastfeeding?
Yes, so they looked at the data, and there was a study published in the New England Journal looking at the outcomes for pregnant women who'd had the vaccine, and they found that there was no adverse events for the pregnant women or the babies. And for women who were breastfeeding, they found there might actually be some benefits in vaccination, that some of the antibodies that the pregnant women might generate from getting vaccinated are passed on to the baby through either cord blood or through breastfeeding. So there could actually be a benefit for the baby for being vaccinated. And so this is only relatively new. And of course, women are encouraged to go and talk to their doctor about this new advice. But it does mean that peace of mind if women are interested in getting the vaccine while they're pregnant, they now have official advice saying that it's safe and recommended to do so at any stage of the pregnancy.
And just quickly, what about vaccinating kids at this stage?
Well, so the advice has changed in Australia now. Pfizer in some states is available for people from the age of 16 and upwards. But earlier, about 2 weeks ago, the government and the TGA did change slightly with the TGA. What they've done is they've offered the option of Pfizer being open to kids up from 12 and onwards. So that doesn't mean that they've given approval for it. It means they've paved the way for the company now if they want to apply to give it to kids from 12 onwards. So there's no guarantee that they'll get it, but we're one step closer, I guess, to giving it to kids 12 and up. And there are still studies being done overseas in that age group that's been done, but also in younger kids now as well.
Sophie Scott, good to see you. Thank you. And that is the show for this week. Thanks for your company. Goodbye.